Welcome back to the continuing coverage of the World Healthcare Congress, coming to you from Washington, D.C., and a special welcome to those who are joining us online. We are here now with Dr. Bernadette Melnyk, Dean at the Ohio State University. It's great to check in with you again.
It's
Dr.
great
Melnyk.
to be here.
Now, I wanted to ask you, we are seeing, it seems, more chronic disease in America.
We are.
Are we doing enough to prevent this? And can you tell me a little bit about what the landscape looks like?
You bet. So today, 1 out of 2 Americans have a chronic condition. 1 out of 4 have multiple chronic conditions, of which the second is often a mental health disorder like depression or anxiety. The interesting fact about chronic disease, though, which, by the way, the American healthcare system spends more money on chronic disease than anything else. But the real interesting fact is 80% of chronic disease is totally preventable.
Right. Wow.
So we can indeed wipe out 80% of chronic disease with healthy lifestyle behaviors.
Okay.
Physical activity, healthy eating, not smoking, getting at least 7 hours of sleep, and very importantly, reducing our stress levels.
Okay.
A simple formula, but not easy. It's what I call character building, because behavior change is tough. And most people don't change behavior unless crisis happens or their emotions are raised.
Who should be leading the fight against chronic disease?
I think we each need to take personal accountability with our own healthy lifestyle behaviors. I really do. If everybody would take personal accountability, but also our healthcare professionals, we need to focus more on prevention, writing prescriptions for physical activity, healthy eating, stress reduction, instead of all the pills that prescriptions are written for. And I'm not saying pills are not effective treatment. Of course they are with certain conditions, but we shouldn't turn to pills first in a lot of cases. We need a bigger emphasis in the American healthcare system on prevention and healthy lifestyle behaviors.
Are we seeing this on the university level, trying to get young people more engaged in their own health?
Absolutely. What's interesting about that question that you ask, at Ohio State, we have about a year partnership with the Women's Heart Alliance out of Washington, D.C. And in our partnership with them, we are focused on young women, their heart health, and their healthy lifestyle behaviors. So this year at Ohio State, we screened and educated 900 young students, primarily women, about healthy lifestyle change, because 1 of 3 women die of heart disease, yet 1 in 31 die from breast cancer. But the majority of the media attention goes to breast cancer.
Right. Right.
So again, we've got a lot of opportunity to affect change in front of us.
You also deal a lot with evidence-based strategies.
Absolutely.
Is this kind of strategy being utilized correctly or as much as it should be?
Definitely not. So we have a saying, it takes about 17 years to translate findings from research into clinical practice in real world settings to improve outcomes. That's far too long. There are so many studies that are published every single year, but so few of those findings make it to the real world. As I mentioned this morning in the keynote panel on the opioid addiction, we have got to focus on prevention. We've got to do it at earlier ages. We have about 60 evidence-based preventive interventions for children, for teens, for college-age youth that aren't being implemented.
And why is that?
Tradition. This is the way we do it here. This is the way we learned it 20 years ago in school. I have a button that says because we've always done it that way with a slash through it. We've got to stop. We have to do the right thing. And the evidence-based practice is the right thing. Plus, we know if every clinician in this country would use evidence-based practice in a regular way, we could drop healthcare costs by 30%, as well as, most importantly, improve people's health outcomes.
Okay, Dr. Melnyk, are there other takeaways that you believe you would like to leave with attendees?
I think I would like to share, we've got to do a better job of integrating mental health with physical health care. Today, 1 out of 4 children, teens, college-age students, about 1 in 5 adults suffer from a mental health problem, yet less than 25% get any treatment. And if they do get treatment, it's usually not evidence-based treatment. So again, lots of opportunity for improvement before us.
And how are you finding the conversations you're having at the World Healthcare Congress this year?
Right on target. I think the panelists that I was on this morning's panel with, we're all in sync. You know, I have a saying though, to know but not to do is really not to know. And again, it gets back to what is insanity. It's doing the same thing over and over again and expecting a different outcome. We've got to use the knowledge that's being generated and get it more quickly translated into practice to improve people's health and wellness.
Dr. Melnyk, thank you again for your comments today. We really appreciate it.
Pleasure to be here.
Thank you. And I'm Mabel Jong. Thanks for tuning in. We have a couple more to go. Thank you.